Okay, in this video, I'm going to be talking about how to take care of your Jackson Pratt drain. So I will also be referring to the Jackson Pratt as the JP drain, but do not get them confused because they are the same thing. So let's go over some of the benefits of the JP drain before we get started. So it helps drain and collect blood and body fluid after surgery. The JP drain provides a constant low suction that pulls the air or excess fluid from the surgical site for faster healing and prevention of complications. It can also prevent swelling and reduces the risk for infection. The tube is held in place by a few stitches and is covered with a bandage. To start taking care of your Jackson Pratt drain at home, you want to make sure that you have the correct supplies to do so. So some of these supplies that you need is normal saline solution, gauze, usually 4x4 dressing or large enough to cover the site, tape, a measuring cup, a cotton-tipped applicator or swabs, and then a safety pin. So now that you have your supplies, let's learn how to drain your Jackson Pratt. You will drain the JP drain at least twice a day or more often depending on how full your drain gets. Follow these steps every time you drain your Jackson Pratt. You want to wash your hands thoroughly with soap and water before even beginning to touch your drain. You will then gather the supplies that were previously mentioned, remove the old dressing, unpin the drain from your clothing, and then once you have the drain unpinned, you will open the stopper slowly away from your face. Empty the contents into the measuring container at least twice daily or when the drain is about half full. Once you emptied your contents into the measuring container, you will record the amount, note the color and type of drainage, and then you will also note the date and time that it was emptied. Then, once the contents are in the measuring container, you'll set that aside and you will squeeze the bulb while it is uncapped. While squeezing, you will then recap the bulb to create that suction. You will pin the bulb drain back to your clothing by the plastic tag to avoid accidental pulling. And then you'll discard the drainage that's in the measuring container into the toilet. Rinse and wash the measuring container with soap and water. So now that you have drained the contents from your Jackson Pratt drain, let's change the dressing. So how to change your dressing? This should be done every single day. You want to follow these steps. First, begin by washing your hands with soap and water. You want to remove the old dressing carefully and discard it, and then after you discarded the old dressing, you will then re-wash your hands. Clean the skin around the drain tube site with a cotton-tipped applicator or gauze soaked in normal saline. Cleanse in a circular motion and be careful not to tug on any sutures. You will then check the surrounding skin around the drain tube site for any redness, tenderness, swelling, warmth, unusual drainage, and leakage. Place the clean, dry gauze over the drain tube insertion site and secure it with tape. You want to make sure that the bandage is large enough to cover the whole incision area and make sure the tape is secure. Then you will wash your hands with soap and water when you are finished. So now that you know how to take care of your JP drain, here are some helpful home care tips that you want to keep in mind. Make sure that you are not sleeping on the same side as the tube or on the drain. You want to secure the drain and bag inside your clothing with a safety pin. This will help keep the tube from being pulled out. You should wear loose garments or loose t-shirts while you have the drain to prevent wound skin irritation. Change the dressing around the tube every single day. Keep the bandage and tube site dry when you shower. During the time that you have a drain, there is no swimming and no taking baths. And then this is a very important step that is easily overlooked. Make sure that you are washing your hands before and after you touch your drain every single time. You want to call your healthcare provider right away if you have any of the following: new or increased pain around the tube, redness, swelling, or warmth around the incision, drainage that is foul smelling or becomes bright and red color, or drainage that changes from light pink to dark red, a fever of 100.4 degrees Fahrenheit, fluid that leaks around the tube, the incision site that seems to not be healing, stitches becoming loose, the tube falling or breaking, blood clots in the drainage bulb, and then a sudden increase or decrease in the amount of drainage. If you have any questions at all, make sure to call your healthcare provider right away. Your safety is our priority, and we want to make sure that you are successful when it comes to taking care of your Jackson Pratt at home. Thank you for listening. Please refer to this video if you need any clarification on any of the information previously stated. If the video does not answer any of your questions, remember to call your healthcare provider.